Naltrexone is traditionally used in high doses to manage alcohol use or opioid use disorders by reducing cravings and the feelings of euphoria associated with substance abuse. But what role does low-dose naltrexone have to play in chronic pain and endometriosis? Well, we're about to talk about it. Welcome to the Endo and Fertility Space channel. I'm Cindy, an Endo and Fertility specialized dietitian, and here on the channel we talk all about endo and fertility. In today's video, I'm breaking down low-dose naltrexone, what it is, what evidence we have for use in endometriosis patients, the method of action, and how it might help you with your endometriosis symptoms. If you haven't already, please give this video a thumbs up, share with a friend, and subscribe to the channel. As of late on socials, I've been getting so many questions about LDN, so I thought, let's start with talking about what it is. Naltrexone use dates all the way back to 1963, but like I mentioned in the intro today, up until more recently, doses of 50 to 100 milligrams were and continue to be used for treatment of drug and alcohol abuse disorders. LDN, low-dose naltrexone, refers to doses 1/10 of the typical dose for opioid addiction treatment. A typical treatment dose for endometriosis and other chronic inflammatory conditions starts with 1.5 milligrams for 7 days, followed by 7 days at 3 milligrams until arriving at the final dose of 4.5 milligrams, which you continue to take indefinitely or until no longer needed. While we currently lack a large body of research for the use of LDN in endometriosis patients, LDN has been shown to reduce symptom severity in conditions like fibromyalgia, Crohn's disease, multiple sclerosis, cancer, and complex regional pain syndrome. So what is the evidence that low-dose naltrexone might help with inflammatory or pain conditions like endometriosis? When you look at the method of action for LDN, the first important thing to note is that it works by blocking a receptor called toll-like receptor 4 or TLR4 on central nervous system cells called microglia. These cells are activated by a wide range of triggers, and upon activation, they produce inflammatory factors that cause pain sensitivity, fatigue, cognitive disruption, sleep issues, mood issues, and a general feeling of malaise. Chronic activation of these cells also causes a series of pro-inflammatory steps that generates brain inflammation. Due to the symptom overlap of microglia activation and symptoms known to occur with chronic inflammatory conditions like endometriosis and fibromyalgia, research and researchers suspect that LDN could be helpful. Research has already captured the helpful effects of LDN on inflammation by showing that use of LDN reduced production of reactive oxygen species and even the production of brain toxic chemicals. As people with endometriosis, we do produce an abnormal amount of reactive oxygen species, which are pro-inflammatory and DNA damaging unstable molecules. Additionally, in human studies in fibromyalgia patients, ESR, a widely used marker of general inflammation, was shown to drop drastically from baseline with the use of low-dose naltrexone. Inflammation-related symptoms were also reported to decline across the board for many inflammatory conditions, including not just in fibromyalgia patients, but also in patients with Crohn's disease, complex regional pain syndrome, and MS. So how is low-dose naltrexone taken, and are there any side effects? LDN is typically taken in doses of 4.5 milligrams right around bedtime. Some people report experiencing insomnia with use of LDN, in which case the medication can be taken during the day. Individuals with strong side effects can adjust their doses to 3 milligrams, but of course consult with your provider. Naltrexone exists only in 50 milligram capsules, so LDN needs to be compounded, and it's most often placed in standard gelatin capsules. There are no reported interactions of low-dose naltrexone with other medications, and minimal side effects have been reported. One of the advantages of LDN, in fact, is that there have been no observations that it causes similar effects as other over-the-counter NSAIDs or pain-relieving medications, symptoms like ulcers, kidney issues, clotting, or heart concerns. So it's a great, safe pain relief option if it does provide you with pain relief. There are also no reported withdrawal symptoms. Vivid dreams is the most commonly reported side effect, and it tends to pass within a few weeks of use for most people. LDN may also cause headaches, anxiety, or unusual heart rhythm, but these side effects are rare. So is there any research specific to LDN use in endometriosis? A retrospective case series of 15 patients with chronic pelvic pain and endometriosis was conducted. The primary outcome for the use of LDN was pain improvement. A review on low-dose naltrexone for endo also showed applicability to endo as it stimulates endorphin release, which helps with pain reduction and helps with immune system control. Specifically, LDN regresses the spread of CD4 plus and CD8 plus T cells and B lymphocytes in the spleen and lymph nodes. CD4 cells, or T helper cells, are a type of white blood cell that plays a very important role in your immune response. When levels are high, it typically represents a robust immune response, which has implications for inflammation, endometriosis behavior, and for fertility. As people with endometriosis, we are prone to an over-exaggerated immune response. If this response overflows into fertility, you can actually be experiencing an autoimmune cause for infertility, recurring losses, or subfertility. These autoimmune causes can be measured through an immunological panel or a lymphocyte map. And while there is no research specifically to show that the use of LDN for these infertility or recurring loss cases can be a helpful tool, it is something to consider in conversation with your reproductive immunologist or with your fertility team. CD8 cells are also a type of white blood cell. High levels indicate your body is actively fighting something, maybe a bacterial or viral infection. CD8 cells may also elevate in response to an autoimmune condition, which unfortunately, as people with endometriosis, we are more prone to developing. So in other words, by helping to support healthy levels of CD8 plus cells, you can actually minimize, or at the very least support positively, your risk of developing an autoimmune disease. LDN also improves ovulation stimulation by anti-estrogen medications, which tend to be more accessible cost-wise. So in other words, LDN has some positive implications for people who have luteinizing unruptured follicle syndrome or who are using medications like letrozole for ovulation induction. While not specific to the endometriosis population, users of LDN with PCOS were shown to experience a significant decrease in BMI, insulin, FSH, LH, and testosterone levels, resulting in higher pregnancy rates. So what are some other uses for naltrexone? The Pope Paul VI Institute used naltrexone 2 milligrams by mouth 4 times daily and tested whether treatment outcomes to hormone supports improved. At this dose, they did not see improvements in responses to hormone therapy like progesterone or HCG, but they did see symptom improvement. They also followed up the study with one that used high-dose naltrexone, doses of 25 to 125 milligrams daily, and found that 90.4% of participants saw improvements in their response to hormone therapy. This is also very relevant for the endometriosis population because many of us live with progesterone resistance, so even some people who are supplementing bioidentical progesterone don't see their progesterone levels climb very well in response. So this is another area of applicability for low-dose naltrexone to help with somebody's response to bioidentical hormone therapy or HCG for ovulation induction. Peak +7 endorphin levels, so this is 7 days after ovulation. The endorphin levels were also increased from 15.9 pg per mil to 22.1 pg per mil. Higher endorphin levels can help with pain and immune function, so there is a lot of applicability here for people who have pain and endometriosis. Thanks so much for watching today's short video. Please like if you found this video helpful, and don't forget to subscribe, and I'll see you in the next video.